We talked about this in the spring with regard to healthcare coverage for 2018 and the need to change the coverage. So the East Ohio Conference has partnered with Westpath Benefits and Investments, which is a general agency of the church, formerly known as the General Board of Pension and Health Benefits of the United Methodist Church. They are your benefits agency, your pension agency. So within the Westpath Benefits and Investments is the Center of Health. They have always been there. And Center of Health has offered conferences, the HealthFlex plans over the years. We have looked at them over the years, and we were doing better 15 years ago, but not so much today. So anyhow, we are moving forward, partnered with Westpath, Center of Health, and what you're going to hear from today is what your plans are going to look like. Your folders in front of you have a lot of detail. It has the presentation that you are hearing. So I'm going to turn it over to Bob and Todd, our gentlemen who have shared 2.5 days of a road trip. Thank you.
Good afternoon, everyone. As Betsy said, my name is Bob Gerlach. I am the Health and Welfare Benefits Manager for Westpath Benefits and Investments in the Center for Health. Today, going to go through this agenda. I'm sure you will have some questions at the end. This is the 6th presentation we're doing, so hopefully we've weaved some of the questions we've heard into this as we go, but do not be afraid to ask questions when we reach the end of the presentation. The agenda is what we're going to cover today. I'm going to give you an overview of HealthFlex and our vendor partners. Going to go over the plan choices that are available to you during annual election, which will be in November. Talk about health accounts, HRAs, HSAs, and FSAs. Combinations of those are available depending on what plan you choose. And then so you don't get too worried now as we go through all this information, there's nothing that you need to decide today. We have decision support tools available to you, including a wonderful new online decision support tool called Alex Benefits Counselor that allows you to go in and literally personalize the utilization you expect to have in health benefits, compare the two plans available, and recommend to you which one they think is right for you. And I'll have more on that later. I'll walk through how you will make your elections during November, during annual election, and then Todd's going to come up and give an overview of the well-being program. Throughout HealthFlex, one of our major focuses is quality. As such, we have partnered with those vendors who we feel have leading industry quality. For medical, that's Blue Cross Blue Shield of Illinois. Since Westpath is in Illinois, we contract with the Illinois group of Blue Cross Blue Shield, but it's really a conglomerate of all the different local blues that you may have seen around Ohio and other states. We have OptumRx for pharmacy coverage. They are right now, I think, the 3rd, although they might be creeping into the 2nd largest pharmacy benefit manager in the US and leverage millions of lives to drive down prices from pharmaceutical companies. We have United Behavioral Health, also known as Optum Health, for behavioral health and mental health services, VSP for vision, and Cigna for dental. For all of these plans, we use their national network, so not a narrow network, but the national network. It means you have coverage wherever you go in the US. On the well-being side, I'm not going to steal too much of Todd's thunder. We have our own well-being programs that we've created and enhanced over the years. They are award-winning programs that have won national awards 3 of the last 4 years. And then we have a great incentive program that participants and spouses can participate in, which allows them to earn money throughout the year. And Todd will go over those. This is kind of the glossary slide. I'm not going to read all the way through it. I'll just highlight why it's color-coded the way it is. The 2 different plan types, the CDHP and the HDHP, are in blue. And then the red lines are the components of those plans: coinsurance, co-payments, deductibles, out-of-pocket maxes. And then the ones in green are the ones that are the health accounts. Green because that's where you can hopefully save some money. Quick overview of how you will access benefits from these vendors. When you hear me talk about your medical plan today, I'm not, for the most part, unless I've indicated so, talking about just medical. So when we talk about selecting your plan, we're talking about medical, pharmacy, and behavioral health. Those are grouped together. So when you elect the plan, you're electing all three of those plans together. For those plans, you will have one ID card that's sent to you by Blue Cross Blue Shield of Illinois. They will send a card if you are single participant only coverage. They will send 2 cards if 2 or more people are covered. If you need additional cards, you can contact Blue Cross for, say, a child dependent who's 18 or over away at college. For dental and vision benefits, we do not send out an ID card. For dental, you can print an ID card offline if you'd like to provide that to your dentist, or you can, if you're a mobile app user, pull it up on a mobile app. And then for vision, you can print a page, it's not really a card at that point, from VSP.com, but they will need to look you up in their system to figure out what your benefits are. So that's why we really don't have cards for those benefits. This slide is one you'll see slightly different as I go through some of our partners. This is meant to give you a quick snapshot for, in this example, Blue Cross Blue Shield, of how you would contact them and when you can contact them. So you can contact them directly through the URL or the phone number on the right anytime after 1/1/2018, when your benefits are live. If you have specific questions that I'll get to in a few slides, there's opportunity to reach out to them beforehand, but for the most part, you're not going to contact them until your benefits are live. The middle section of this slide talks about going to HealthFlex WebMD through westpath.org. WebMD is our portal to all things HealthFlex. That's where you'll go to make your annual elections, and I'll talk about that in a little bit. And once you log into WebMD, you can get to links to all the vendors, and the ones that are considered the major vendors, medical, pharmacy, health accounts, you can single sign-on directly to those benefits. So you don't need to remember an additional username and password for Blue Cross or OptumRx or WageWorks. One key point on this slide I also want to point out is that through Blue Cross Blue Shield of Illinois, we have what's known as benefit value advisors in their customer service area. As I talk about the 2 types of plans, and as plans move towards more consumer-driven plans, there's more of a need for you as participants to have transparency to cost, because as time goes on, the way that plans are moving, we're beyond the days of $15 copay to have a baby who's in the hospital for a week. It just doesn't happen anymore. There's deductibles that need to be met, and until those deductibles are met, you're paying for services out of pocket. So if you're looking for a specific service, not an emergency service, not something you need right away, but for example, if you need to get a couple MRIs a year, you could go to the hospital, and most hospitals will charge $1,000 or $1,200 for that MRI. And up until you meet the deductible, you're responsible for any of those charges. But if you go to one of these freestanding brick and mortars that specialize in just MRIs, and you go in and get an MRI, and they either forward the imaging to your doctor or give it to you on a CD to take it with you, they might charge $400 or $500. So if you haven't met your deductible, that is immediate savings to you. And even if you have met your deductible and the plan is paying coinsurance, you're still responsible for a portion of that, so you would be saving money there too. What the benefit value advisor will do is they will help you find a provider of that service that's in network so that you can do your research and figure out where you would want to go. You can give them the zip code for where your work is, if you'd want to go closer to work, where your home is, whatever. And again, not for the emergency situations. I'm not saying you should leave the hospital and then call BVA to find out where you should have something that you need immediately. But for those people who have a more chronic condition, a condition that needs to be monitored over time, that's where you would want to use BVA. Another example would be if you aren't sure if you broke your wrist or not, and you need to know if there's an urgent care close or an ER close. So not something that you need to do within the next 10 minutes, but something you should probably do within the next couple hours. They're a good resource for that as well. When we looked at access for Blue Cross, we used what's known as the adequate access radius for a zip code file. And this is pretty standard across all vendors when you look at the radius they're using. They break it down into urban, suburban, and rural, and have different criteria for what's considered adequate coverage. So for those in an urban environment, if you have 2 primary care physicians, pediatricians, or specialists within 8 miles and a hospital within 10 miles, that's considered to be adequate coverage. And that's in-network providers. And then when you go to suburban, it puts that radius out a little further, and it says for the primary care providers, 2 within 15 miles and a hospital with 20. And then for the rural environment, it's 2 within 20 miles for providers and a hospital within 30 miles. We had them look up every single zip code within the East Ohio Conference, and all had what was deemed to be adequate coverage. So the good news is that there's pretty good options for coverage in East Ohio. This is a list of some of the hospitals. I found out in the last session that I maybe didn't do a great job in covering all of the East Ohio area, so I apologize for that. This is a short list of all the hospitals that are available. I tried to get the ones closest to where we were presenting because I figured that would make sense, and it were the ones that I had easiest access to the zip codes, but some are definitely missing here. If you are trying to find where if your provider is in network, that is something that you can do now. You can go to bcbsil.com. The screenshots here will be from a desktop computer, not from a mobile phone. So I will get to a mobile device in a moment. But you would click Find a Doctor. It is important to use bcbsil.com only because the flow looks differently if you don't. And then you would select your network. It is the large national network of Blue Cross, so it's their participating provider organization, PPO network. And then once you've done that, you can search by your doctor's name, hospital or clinic name, a specialty you're looking for, the zip code if you're trying to keep it within a certain range, and find the provider there. If you are using a mobile-enabled device, an iPhone, an Android, a tablet of some type, there's a couple little quirks. The first is that if your location services are not enabled, it's going to assume, because this is BCBSIL, that the doctor you're looking for is in Illinois. So you're going to want to make sure you select that you're looking for someone in Ohio. And then the other thing is that when you select the network or plan, that screen looks a little different. So you will need to make sure you're selecting the right name from the drop-down. Other than that, you should get the exact same results. For those of you who find that your doctor is not in network and you are undergoing one of the types of treatments that we have listed here, you would want to contact Blue Cross Blue Shield to see if you can get a short-term network exception. This would allow you to continue to seeing your current provider for up to 90 days, so you don't have a break in that treatment and need to immediately switch over to a new doctor. When you look at the in and out of network benefits are generally 20% less generous than in-network. So if you're in a plan with 80% in-network coinsurance, out of network it's going to be 60%. So if you qualify for one of these, you would want to get that relief for up to 30 days while you're looking for a new doctor. Otherwise, you would be responsible for that additional cost. This is that scenario where you would want to contact Blue Cross Blue Shield of Illinois before January 1st. You'd want to handle it probably in mid-December to make sure there was enough time to get the approval before you had to see your doctor in January. Here's that customer service related screen for contacting OptumRx. Again, you could log in directly through them after January 1st, on or after January 1st. You can get to them via single sign-on through the HealthFlex WebMD website, and you can contact them on their customer service line, and that you can do a little bit before AE, and I'll get into that in a minute. With OptumRx, we have a dedicated customer service line with a patient advocate, which means they are trained specifically in our plans, and they only handle a certain number of different clients. So these are people who are talking to HealthFlex participants every single day. They know the plans very well. The other thing that we have with OptumRx, it's a new program that started this year that allows 90-day refills at Walgreens. For maintenance medications, and those are the drugs that you take every single day, usually high blood pressure drugs, lowering cholesterol drugs, metformin, things like that. You get 3 fills at a local pharmacy before you have to get it filled at mail order. And that's to make sure that the plan, you fill it at mail order to make sure that the plan pays for their portion. And I'll get into that in just a second. The plan, or OptumRx, has a couple things that they do with the prices. When a pharmacy company sets their retail price, that's the price that's like way up here. And then because you have coverage in a plan, you get the price that OptumRx has negotiated, and they've been able to negotiate a low price because they have millions of lives in the plan, and that knocks it way down. If you still go to retail after the 3 fills for that specific drug and that specific dosage, you would pay this price. Once the plan kicks in, then you pay that further reduced price, and you'll see what those co-payments look like. We do that to, 1, promote people taking their medications. There's a lot of studies that show that when people have their medication on hand, they're more likely to take it, and when it gets delivered, they don't have to go out and get it. So that's one reason. The other reason is that it's far less expensive to send out 90 pills at a time than it is to pick up 30 pills at a time. There's filling costs and all those things. They're trying out, and I don't expect it's going to go away anytime soon, but this idea of picking up your 90-day scripts at Walgreens, and it's exclusive with HealthFlex that you have to go to Walgreens. Unfortunately, I haven't seen a lot of Walgreens as we've been driving around. I was very hopeful when they were talking about Walgreens and Rite Aid, because I've seen a ton of Rite Aids, which would have been great. At this point, I'm not sure how many people will be able to take advantage of the Walgreens. We are evaluating, along with OptumRx, what makes the most sense for HealthFlex as a whole. Will it be Walgreens? Will it just be going mail order? Will we be able to switch that at some point in the future? We don't know at this point. It's really, I wouldn't call it a pilot, but this is year 1 for OptumRx doing this as well. So they're going to have some learnings. Walgreens is going to have some learnings, and they'll figure out where they land long term. In addition to mandatory mail order, we have 3 other things in place to keep costs down and promote safety: prior authorizations, step therapy, and quantity limits. The quantity limit is pretty easy to understand where the safety and cost savings come in. You don't want people getting more pills than they're going to take, because that's a waste. And you don't want a mistake to end up giving people the wrong number of pills, because most people will get the pills and they'll take them till they're gone, and if they get too many pills, they might be over-medicating themselves. So we have those in place. Most of the time, the quantity limits are really correcting an issue where maybe the doctor wrote it a little too messy, or maybe the pharmacist couldn't make out the number of pills. So the system will kick it out, so the pharmacist, or maybe the pharmacist types it in wrong when they're trying to fill the script. So that's why quantity limits are there. When you look at step therapy requires that until you go to a more expensive and less utilized drug, the doctor has ensured that you've taken the one that's been around the longest, that's probably a generic because it's been around so long and it works so well, and that you're taking the right course of treatment. So it also stops the person from being able to go to the doctor and saying, I saw this drug on TV when I was watching football, and I would like to take that drug. So it makes sure that whatever drug is available, whatever drug you're taking, is the right drug for your condition. And then on the prior authorization side, that one's really making sure that if you're taking the drug for, I don't want to say off-brand use, but not one of the main reasons that that drug is prescribed, that it's for the right reason. So for step therapy and prior authorizations, OptumRx is going to ask your doctor to just provide some documentation that everything is in order. If you know now that you've gone through step therapy or you've gotten a prior authorization, you should probably reach out to your doctor in December so that they are prepared to provide that to OptumRx when you next need to fill your medicine through OptumRx. The other thing that we suggest is, since you are transitioning from one pharmacy benefit to another, we recommend filling your prescriptions as late as possible so that you do not have to worry about going without medication if there is a delay. Generally, medications are filled within 3 to 5 days, even if it's mail order. Obviously less than that if you're going to the pharmacy to pick something up. But January 1st is the busiest time of the year because, like you all, there are plenty of people who are changing their plans effective January 1st. We don't expect any delays, but I definitely don't want you to be without medication that you need. To find out where your drug is on the formulary or to discuss it with your doctor if you have a concern, you can go out to OptumRx's website beginning 1/1, but better would be to call them in later October, so probably after the 15th would be the time to call them. Let them know what plan you're looking at of the 2 plans you have to choose, and they can let you know what it's going to cost you and if it's on the formulary. The formulary is not going to change, the cost might, and I'll get to that in a minute. If you are taking a generic drug that you know you will continue to take, there will be, with 99.9% certainty, a generic drug on the formulary that you can take. It might be a different name, but it's going to be the same active ingredients. When you get to like a preferred drug, it might not be the one that you saw the commercial for yesterday, but it'll be the one that you see the commercial for tonight. So the competing commercials. The pharmacy benefit managers go exclusively, usually with one drug when it gets to the preferred, because that's the way they can drive down the price. But only if they only do that if it's really treating the same issue. If there's a drug that you need, rest assured there is a way for you to get it, as long as there's a medical reason to have it. And then prior authorizations, again, you can contact in December. Phone number again if you need to reach out to OptumRx. This is a quick shot of what the OptumRx website looks like. I'm not going to read through the whole thing. Want to call out too, I already talked about transparency and cost and how it's getting more and more important in healthcare. OptumRx has on their website a way for you to price drugs at up to 5 different pharmacies that are nearby. There's a couple reasons to do that. You'll see in a few minutes that we have a generic copay when you go to the pharmacy for a regular 30-day script or a 5-day Z-Pak or whatever it is. That's what we charge, assuming the cost of the drug is more than $15. If it's less, you pay the price of that drug. If the drug costs $7, we're not charging you $15, we're charging you $7, based on where you get it filled. You will see, for certain drugs, that a Walgreens or a Rite Aid will price it lower than a Walmart, or a Walmart will price it lower than whomever else. So that's a way for you to see if there's a better option for you to save some money. The other thing you'll want to do is see, for example, Sam's Club. We have a coworker who works at Sam's Club, and she goes to Sam's Club every month for one of her medications because Sam's Club charges only $4. And Sam's Club is willing to take a loss on that drug because they're getting you in the door to buy other things. So what we want you to do is we want you to be good consumers of healthcare and honestly spend as little as you have to be healthy, right? Definitely get your drugs. Definitely use the plan if it's going to save you money. But we are not making money off of you filling prescriptions through the plan. We want you to take your prescriptions and be healthy. The other thing you'll find for some people, especially people who are taking those name brand drugs that are on TV all the time, you might have coupons available from the manufacturer. Coupons and pharmacy benefits don't work really well together. I spoke with someone, I think it was yesterday, and he gets a coupon every month, and he's able to go to the pharmacy and get his drug for free. If you can get your drug for free, I suggest that you do that. There is no need to go through and pay through OptumRx, through your HealthFlex benefit to get your drug. Get it for free. And then for those on mail order, there's an order status here, so you can see if your prescription's gotten there, if they've approved it, when it's mailed, if it's on the way, things like that. So just a couple things from that slide. United Behavioral Health, or Optum Health, is the vendor we've chosen for behavioral health and mental health services. We do not have single sign-on to their site. You must log in directly to them. You can get to the link to their site through WebMD, but we won't single sign-on over yet. We evaluate all the time. Right now, the utilization is not there to justify the cost. You can contact them on or after January 1st via the website, via their phone number. talk a little bit about what we've done for office visits here. Unfortunately, behavioral mental health services networks are not as broad as we see on the medical side. And there's a great deal of specialization within behavioral and mental health services. Because we feel that the network is not broad enough to provide adequate coverage for people to always go in network, for those office visits, those 45, 50-minute sessions, we've mirrored the in-network benefit with the out-of-network benefit. So I think I said earlier that if you have an 80% coinsurance plan, when you go out of network, that generally drops to 60%. Well, that's not going to happen here. We're going to keep it at 80%, even if you go out of network for a behavioral health specialist. What usually happens when you go out of network, even if the plan pays 60%, if that provider feels like the plan does not reimburse at an appropriate level, because they're out of network, they can choose to balance bill you and make you responsible for the remainder amount. What we've done here is we have disallowed the balance billing for those 45 and 50-minute sessions, and the plan will pay for those. This is a very underutilized benefit, and we want to do everything we can to make sure people get the help that they need. Another component of Optum Health, or UBH, is the Employee Assistance and Work-Life Services Program. I'm not going to talk about it too much. Todd's going to talk about that a little bit at the end. You do get 8 no-cost visits through one of their providers, so it's a good place. If you need some assistance, your dependent needs some assistance, someone to talk to, you would start there. If that's a person you like, they will automatically be in the network, so you don't have to look for anybody else. You can reach out to the EAP professional telephonically, in person, online. You can get referred there, perhaps by a medical doctor. That's for the emotional counseling services. They also offer some work-life services, helping you find childcare, helping you find a lawyer if you need it, pointing you to an accountant, things like that. And Todd will talk more about that. We have Cigna for dental. No single sign-on for dental. Dental is very much an optional plan, so we don't have the number of lives in dental right now as we do for medical and pharmacy. So it's not cost-effective yet to have single sign-on. We are evaluating. Again, no ID card. Contact them on or after January 1st. And if you are looking for a new dentist, or you want to see if your dentist has the maximum benefit, I know dentist choices are very personal as well. The PPO Advantage Network is going to give the highest reimbursement for in-network services, and more on those in a minute. For VSP, they have a mobile app, no ID card again. Contact them on or after January 1st. But like Cigna and Blue Cross Blue Shield, some of the others, you can find a VSP doctor online now. There's no need to sign on. VSP.com, enter a zip code, and it'll let you know who's in network. Here is our WestPath Health team. -1, these are the group of people that are a branch of our customer service department at WestPath who handle all of your health inquiries. More importantly than just the questions they can answer for you is the advocacy they can provide. Very often, if you have an issue that you cannot get resolved with the vendor, you can contact the health team. If they're not able to answer the question, if they're not able to get you a resolution, they will contact the provider with you on the phone or on your behalf. They will contact the plan, if it's Blue Cross, if it's Optum Rx, with you or on your behalf to help drive that solution. By far, when we have people in Betsy's position from other conferences come into our building, the only people they want to see is the health team, because they want to thank them for helping them or helping participants. They are a phenomenal resource. Should you have any questions going through annual election that you can't find the answer to, or you just want to hear a person, that's who you want to call. So now I'm going to move on to plans. And this is where it's probably going to get more confusing and more detailed, and I apologize for that. I will make it as simple as possible. However, Alex, benefits counselor that I talked about earlier, that you'll see some more information on here, is a great resource for getting questions answered and figuring out what plans you want. There's two types of plans. I'll explain those in a minute. A consumer-driven health plan and a high-deductible health plan. So that's one way to think about the plan. The other is how generous are benefits. A gold plan on average reimburses 80% or covers 80% of medical costs. And a silver plan on average covers 70% of costs. So what you're looking at here is a slightly higher premium in the gold plan to have potentially less out-of-pocket exposure for yourself later. And then for the silver plan, a little lower premium than the gold plan, but the chance of spending a little bit more out of pocket should you have medical services that you need. The C2000 is our CDHP plan. It is a deductible coinsurance plan. That means that until you meet the deductible, the plan does not pay anything. And then once you meet the deductible, which is $2,000 for an individual or $4,000 for a family, the plan pays 80%. So once you reach that deductible, the plan pays 80%. Wellness visits don't count here. Those are covered at 100%. You don't have to pay for those. Big difference between this plan and the next plan I'll talk about is that there is no pharmacy deductible. That means that costs, anything you spend on pharmacy, does not go towards your deductible, but you also do not need to meet the deductible before the plan will pay towards pharmacy costs. So it's first dollar pharmacy coverage in this plan. And then to help lessen that blow of the $2,000, $4,000 deductible, these accounts are funded, or you have a health reimbursement account that's funded on January 1st with $1,000 if it's single only or participant only coverage, and $2,000 if it's two or more. This is not additional money that you're required to put in. It's not additional money that your church or employer or conference is putting in. This is built into the plan. It comes with the plan, and it will be there on January 1st. The other plan, the given plan, the plan you will get if you do not make an election online, is the HDHP H2000 plan. This is an IRS qualified high deductible health plan. I'm sure you heard me say IRS qualified, so since the IRS is involved, it gets a little more complicated. This is also a deductible coinsurance plan, which means the plan does not pay until you meet your deductible. It also means that it will not pay for pharmacy until you meet your deductible. That is a requirement of a high deductible health plan. You'll see that the deductibles are the same, $2,000 for an individual, $4,000 for two or more people. However, if more than one person is covered in the plan, another little quirk of a high deductible health plan is that you must meet the full family deductible before the plan pays. That means you are responsible for everything out of pocket up to $4,000 in that scenario, except for wellness visits, until the plan will start paying, and then the plan will pay 70% and you'll be responsible for 30%. This account, because it's a qualified high deductible health plan, or this plan, because it's a qualified high deductible health plan, comes with a health savings account. And that is funded day one, again like the HRA. This is not money you're putting in your conference, your employer, your plan sponsor, your church. It is money that's built into the plan, available day one to help minimize that big deductible impact. So it's $500 for an individual here and $1,000 for two or more. Quick examples of how the plans are alike and different. If you go to, and this is not wellness visits, but if you need to go to the doctor, PT, psychologist, have an inpatient or outpatient surgery, you're going to meet your deductible, and then the plan's going to pay its coinsurance. That's the same for both. For medications, note that when you look at the HDHP H2000 Silver plan, it says that you must meet the deductible first. It doesn't say that on the C2000. So if you go to the doctor for a wellness visit and the doctor says, you know, I really think we need to get your cholesterol under control, here's a prescription. We'll assume it's a generic. You'll go to the pharmacy and pick it up, and for that 30-day script, you'll pay $15. If it's the high deductible health plan, you'll pay whatever the cost of that medication is once it's been reduced from the real high pharmaceutical company retail cost down to the having insurance cost. So you won't pay that crazy price. You'll pay still a higher price than if it went through insurance, unless it's one of those that you can get at Walmart or Sam's Club for $4, until you meet your deductible. So both medical plans include a lot of the same things. Wellness preventative visits, nothing covered until you hit the deductible for everything else. When I talk about the plan, that's where I'm saying it's medical, pharmacy, and behavioral health together. They both have those same things. It is the exact same pharmacy plan for both. The behavioral health and medical plan have the same coinsurance, so the coinsurance will be different between those plans, but how they function within that will be the same. Out-of-pocket maxes, which you'll see shortly, are the same. Everything that you pay, deductible, coinsurance, copayments, medical, behavioral health, and pharmacy all go towards that out-of-pocket max, even if they don't go towards pharmacy in deductible in the C2000. Again, all those services require deductible to be met. There's no lifetime maximum in the plan, no matter how expensive it is for you to get your health care. No, we don't cap you out at $1 million or $2 million or $10 million. So you don't have to worry about that. And then Todd will talk about the comprehensive well-being programs and incentives available. This is a quick in-network at a glance of how the plans stack up against each other. We've covered everything so far here except for the bottom line. The bottom line is that out-of-pocket maximum. So you'll see that for a single person in the C2000, it's $6,000. In the H2000, it's $6,500. So that is the most a single person would have to pay in a given year before a plan covers everything else in network. And then if the family hits $12,000 in the C2000 or $13,500 in the H2000, then you're done paying for anything for the whole family for that plan year. Again, this is just another way to look at kind of the highlights. We like to say deductible, coinsurance, and out-of-pocket max, just showing you those amounts side by side. Again, highlighting for the H2000, you must meet the full family deductible before the plan pays. So my family is in a high deductible health plan this year. We've had, I don't know, maybe $800 in expenses for my daughter because she went to the ER and got sick a couple times because she's 5, and that's what they do. They get sick a couple times. We will, as a family, need to hit $4,000 before the plan pays. So up to this point, I've been fortunate enough to have the money in my HSA to pay for what we've had out of pocket. If we were in the C2000 plan, for my daughter, if she hit $2,000, the plan would have paid for her once she hit $2,000. Because of the high deductible health plan, it's got to be $4,000. It can be a combination of everyone in the plan. So if she racks up $1,000 and then my wife and I each rack up $1,500 or so to get us to the $4,000, we can do it that way. If my daughter hits $4,000 on her own, we've hit the family deductible. But it is a consideration, especially depending on how many people in the plan in your family consume healthcare costs and the most healthcare. So it's something to think about. Again, listing out how the pharmacy plan works for both the C2000 and H2000. You'll see if you look at the silver ones, everything says after deductible. Aside from that, they cover at the same amount, showing the generic copay amount, the coinsurance on the plan after you've met the deductible in one versus not the other. And this is what you're paying, not what the plan's paying. So for a brand preferred, the plan is paying 75% of the cost. And a non-preferred, they're paying 70% of the cost. Again, if the actual cost of the medication is lower than the numbers you see here, that's what you pay. We don't mark it up to get you in this range. If the actual cost of the medication is $20 in the brand preferred, you're going to pay $20. We're not going to bump you up to $25 to $65 for that. Dental plan choices, you have 3. The first 2 are very similar. The passive PPO 1000 and 2000, the only difference between those is the maximum annual benefit that the plan will pay, $1,000 per person or $2,000 per person. Both plans have 80% coinsurance, whether you are in network or out of network. But remember, like I talked about on the medical side, you can be balance billed if your dentist is out of network and doesn't like the amount that the insurance has said is a reasonable amount for that service. If your dentist is in-network, or if you choose an in-network doctor, you'll want to make sure they're in the Advantage network. Because if they're in the Advantage network, the coinsurance on that plan jumps up to 90%. So for basic restorative like fillings things like that, the plan would pay 90% up to that maximum annual benefit, and these maximum annual benefits are per person covered in the plan. So just highlighting with the passive, if your dentist is not in network, you still get a very high coinsurance on sticking with that dentist. I know that I like my dentist. I wouldn't like to change my dentist. Dentists are very personal. Don't want anyone just poking around with sharp objects in your mouth. So we offer these two plans so that you can keep your same dentist even if they're not in network and still have a high benefit level. Two little limitations, quirks on the dental plan. For missing teeth prior to 1/1/2018, any work that has to be done in relation to that missing tooth is only covered at 50% of the normal benefit for the first 24 months. The example I like to use is if you have a post or if you have a crown, if you have it in place now, they're not going to give you the full benefit coverage until you've been in the plan 2 years. The other limitation is more straightforward, and I think more commonsensical once you hear it, and it's talking about orthodontia coverage for children. Basically, only the services that take place when you have insurance are the ones that they're going to pay for. So if your child gets braces today and you try to submit that through Cigna in January, they're going to say, no, you didn't have insurance at that time. But if your child gets braces today and then gets them tightened or adjusted in January, then you're covered on the plan, and the plan will pay for that. Vision choices, there's 3 different vision plans. The one that you'll get automatically if you don't make any choice is exam only. That is free. And then there's 2 buy-up plans. One is the full service, which gives you $150 allowance per person covered in the plan towards lenses in your frame that are in your frames or contact lenses. One or the other. If you go to the Premier, and if you look at the pricing sheet that Betsy gave, you can see the difference in cost for the Premier. It is a much richer benefit, and it comes at a higher cost. You still get exam like you do in any of the plans, but you will get $200 towards glasses and contacts every plan year. When you look at those costs, the one thing I like to say, I'm in the Premier plan. I wear glasses and contacts. My wife wears glasses. Our daughter doesn't wear anything on her eyes, so we have, even though we have the Premier plan, I figured that we will be getting, as long as we use the benefit, we will be getting $600 allowance, $400 for me, $200 for my wife because she doesn't have contacts, $600 allowance for the year for glasses and contacts, and unless I messed up my math, when I took the monthly cost and extrapolated it out 12 months, we're paying less than that for the coverage. So, and we still all get eye exams. So for me, for our family, it made sense because we will use the benefit. Certainly when you go through Alex Benefits Counselor, you'll be prompted with some questions. They will help you determine which of those is going to be the best plans for you. Health accounts, maybe the most complicated, most likely the most complicated thing we're going to talk about this morning. We have 3 different types of health accounts. An FSA, which most of you are probably familiar with some of the FSA, if not all. The HRA, that's the one I talked about earlier that's built into the consumer-driven health plan, the C2000 plan. And the HSA, that's a component of the IRS qualified high deductible health plan, the H2000. All of these accounts offer you a way to set aside money to offset future medical expenses. And when I say medical expenses, medical, pharmacy, dental, vision, all those. Some of them also have tax savings for you. If you have any questions about these that I am not covering today, or about your personal situation, you're going to want to use the Alex Online Benefits tool or contact EY, previously known as Ernst & Young. For those of you who have pension through Westpath, you may have heard of Ernst & Young. They are well-versed in our plans, well-versed in HSA investment options, and will be able to help you determine what might be the best for you. I'm not going to walk through these math slides. All these are highlighting. This slide is highlighting for the FSA, the medical FSA. If you contribute the max of $2,600 and you use the max of $2,600, you would save almost $800 in taxes because it is a free benefit. On the HSA, this is just showing how much more drastic the savings can be, because you can put up to $6,900 for a family in an HSA annually. So if you actually spent that on healthcare, you would have saved just in the tax benefits over $2,000. FSAs, many people are familiar with FSAs, and oftentimes you think of FSA as the one you use to reimburse your medical account, your medical services. There's another component of the FSAs, that's the dependent care account. Again, not utilized by a ton of people. It's mainly for care provided to dependent children under age 12, daycare, before and after school programs, summer camp, but certain adult care can be covered. This money is 100% use it or lose it. Whatever you put in this account, I want you to make sure you spend by the end of the year, so do not over-contribute. If you don't use it, you will lose it by the end of the year. You can submit claims for reimbursement, and once the money is deposited in the account, you can take it out. The other FSA, and the far more common one, is the medical reimbursement account, as we like to call it, or medical FSA. Reimburse for those eligible medical, pharmacy, behavioral health, vision, dental expenses. In this plan, you don't have to be as specific in what you're putting away, because up to $500 will carry over into the next year. So for sure, spend it down to $500 so you don't lose anything. Anything over $500 you will lose at the end of the year. This money is available on day one, so if you elect $2,000, that $2,000 is there January 1st if you need it. You'll kind of reimburse the plan as you go through salary deductions. And you can use a debit card, which I'll talk about in a little bit, to buy at point of sale, or use that card to pay a bill, get reimbursed, whichever way you prefer. Now the HRA and HSA, the much more complicated health accounts. The HRA is the one, again, that comes with the C2000, fully funded with $1,000 or $2,000, depending on who's covered, on January 1st. And the HSA is the one that's with the high deductible health plan that gives you $500 or $1,000 on day one to use to offset those medical expenses. Both of those plans can be used to pay the same type of expenses. Both of those plans roll over. You will not lose $1 at the end of the year as long as you're still in the plan. And both will use a debit card as well as other ways to get reimbursed. The differences. The HRA, the one that's built into the C2000 plan, you cannot make personal contributions into that plan. Deposits are made annually if you keep electing a consumer-driven health plan. Those deposits will be there on January 1st and can accumulate if you don't use the money. That money does not earn any interest, and there are no fees that you need to pay on that account. The H2000 is where it gets complicated. Remember, this is an IRS qualified high deductible health plan. Since it's the IRS, there's a whole lot of reporting and a whole lot of rules that get into place. You personally can contribute money into your HSA. You can contribute up to, on the next slide, $3,450 for an individual, or $6,900 if you have a family. That does get reduced by the amount that's being deposited at the beginning of the year, the $500 or $1,000. This IRS limit doesn't care who's putting the money in the account. They care about the limit. And then if you're over age 55, you can put an additional $1,000, regardless if it's just yourself that's covered or if it's someone else with you. Within the HSA, there is a fee, a $2 a month fee, until your account reaches $5,000, or until when it reaches $1,000, you choose to invest that in some of BNY's funds. And this is really to offset a lot of the reporting charges that BNY Mellon, that's who the account is through, has to submit to for the IRS. The other major difference between these two accounts, and the one that's most important to those who are 65 or will be 65 within the next couple of years, will be Medicare eligible within the next couple of years. The HRA, the one that's paired with the C2000, no change once you take Medicare A or B, once you're Medicare age, that account can still be funded for you. On the HSA, once you have Medicare, you cannot contribute anymore to that health savings account. Additionally, the plan cannot contribute anymore on your behalf. So if you are in Medicare now and you select the H2000 plan, or you don't go online to make an election and you get the H2000 plan, because that is the default or given plan, you cannot have the money that's built into that plan. So you need to figure out if that's the best route for you, because you will not be able to take full advantage of everything that that plan offers. The plan is designed to work with the qualified HSA. There's nothing that says you have to have an HSA, but that does maximize your benefit of the plan. This might be the trickiest part that I'm going to get to in a moment, and it's how the HRA and HRA and HSA work with an FSA. If you have an HRA with the C2000 plan and an FSA, you don't have to worry. They work together very well. The plan will automatically deduct from the FSA first, because that is your spending account. That's the one that you'll lose. We don't want you to lose any money, so we've designed it that it takes from the FSA first. Once the FSA is exhausted, it would then take from your HRA. The HSA, again, the IRS qualified plan, is where it gets complicated. The IRS, to make sure that highly compensated employees do not have an additional advantage by being able to defer more money from taxes, requires that you cannot use your flexible spending account towards the deductible of the high deductible health plan. Part of the reason that the plan is qualified to have an HSA is because it has a deductible at a certain level. The IRS wants you to use HSA money or other personal funds, but not FSA money, to pay that deductible to a certain point before you can use the flexible spending account. They don't want highly compensated people to be able to pay for all of their expenses with their flexible spending account and just keep socking away money in their HSA forever to avoid the tax penalty. Until you meet what's called the IRS defined deductible, if you have an FSA and an HSA, your FSA can only be used for dental and vision expenses. Your HSA would be used for medical, pharmacy, behavioral health. The good news is you don't need to remember that, because WageWorks is already set up to accommodate, and I'll get to that in a moment. The IRS defined deductible for switching to use your FSA is $1,350 for an individual or $2,700 for a family. So fortunately, it's less than the deductible on the plan. So you can still pay some of your deductible with the HSA, and then if you knew you had those expenses or you had the FSA available, you could then switch it over to your FSA. The way you would do that would be to contact WageWorks. They need to know, and they do need proof, in case they ever got audited for reimbursing benefits, they need proof that you met your IRS defined deductible. That largely means providing your EOB and proof of payment, not anything that's too ridiculous, pretty easy to do. And then after you meet that deductible, they'll flip a switch. This is our water cooler example. On the left, and this really only applies to FSA and HSA. On the left, before you met the IRS defined deductible, if you had dental and vision expenses, they will come from the FSA first, and then the HSA. The card, the WageWorks system, is all smart enough to know that if it was a medical, pharmacy, or behavioral health expense, it needs to come from your HSA. Once they flip that switch, if you look over on the right to the after, then it will flip it and start pulling from your FSA first, so that you don't lose those monies, so that you can keep saving in your HSA, and once that's exhausted, it goes to the HSA. So basically, it knows to take the bottom water first before the top water. And it does work. I actually have an FSA, an HRA, and an HSA, which further complicates, and I've never had any issues with dental, vision, pharmacy pulling from the wrong account. WageWorks, our health account administrator, we do have single sign-on to their site. They have a phenomenal mobile app for those who like using mobile apps. Occasionally, if you go to a mom and pop pharmacy, for example, they might not be on the IIS system that lets WageWorks know that it's an FSA eligible expense. So WageWorks will ask you for a receipt. I can take a picture of the receipt with my smartphone and just send it to them through the app and not worry about it, which is pretty cool. They also have multiple ways to pay your provider. I mentioned I'm in a high deductible health plan. What that generally means is a lot of times when I go to the doctor, they bill me. Sometimes they'll take a copay, just assuming there's something I'm going to pay anyway. So I'll use my card to pay the copay, and then they'll send me a bill in the mail. Once I get that bill, I can call them and give them my debit card number over the phone. I could write it in and mail it back to them. I could mail that into WageWorks and ask them to cut a check. I can scan it into WageWorks and ask them to cut a check to the provider, or I could pay it from some other way, save my receipt because I want to get some Christmas money in November, and then I could ask them to send me a check or deposit it to my account at that time. So there's a lot of different options to get your money from WageWorks. Some rules on the health accounts. We already talked about HRA, HSA, keep carrying over, no limit to accumulate. You can accumulate thousands of dollars over time. The FSA, only $500 carries over to the next year. If you retire in these plans for the FSA, you've got 90 days to make claims back to the last day you were covered. So FSA, you must be covered in the plan to get reimbursed from the FSA. The HSA is yours forever, and the HRA, again, you have those funds available through retirement. Where it gets a little tricky is if you waive out of coverage or you terminate from HealthFlex. With the HSA, again, nothing changes. That's your money forever. With the FSA, it works like if you terminate from the plan or retire. The last day you're covered is the last day you're eligible to use those FSA dollars. And then the HRA has its own little trickiness to it. If you leave the UMC, if you terminate, if you waive out of coverage, you have 90 days to use that balance, but it does not have to be for services while you were employed and enrolled in the plan. So if I terminate December 31st, I have through March to use that money for any expenses I would like to spend it on. So I could stock up on contacts or glasses or go see the doctor. It can be used in conjunction to pay bills that were not covered by new insurance if that happens. So we're not looking to penalize anyone for leaving the plan, but there is cost associated with maintaining these accounts, cost the plan pays. And most importantly, there's government reporting that we have to do on HRAs, and we don't want to report forever on an account with a $3 balance because that's silly. Alex Benefits Counselor. You can actually go out to WebMD and register today and start using Alex Benefits Counselor. You would go to westpath.org, scroll down a little bit depending on how big your screen is, and select HealthFlex WebMD. It's our gateway, as I said earlier, to all things HealthFlex. You can get a ridiculous amount of information from this site. You will go click first time here, register. They're going to ask for first name, last name, social security number, and birth date. That's all you need. Then you'll create your own username and password. Remember that because you're going to need it for everything HealthFlex. Once you log in, on the right there in the red box, click Meet Alex, and then Alex will start asking you questions. Again, you could do it now. It's going to be available all through annual election as well. It does a much better job than I do of explaining things in plain English and non-technical jargon. It uses lively graphics and animation, even some humor. Some of it's funny, some of it maybe not, depending on you. It does not really take that long to get a ton of information out of Alex. 30 minutes in full, and that's for all of these different modules if you really went through and wanted to learn every single component of the plan. For most people, it's about 10 minutes. And a lot of people don't spend the necessary time figuring out what their medical benefits should need based on what they're going to use. I talked with my wife yesterday morning for 10 minutes about why she needed a certain kind of black boot. And my hope is that those come nowhere near to the cost of even 1 month of health insurance. Alex is going to go through and ask you questions. And it's going to ask questions based upon what you think you're going to use for medical benefits. And you can put in as many different scenarios as you want, walk through it as many different times as you want. But it's going to ask, how many times do you go to the doctor? Do you want to plan for an ER visit or an urgent care visit? How many prescriptions are you taking? Goes through all of that for everyone in your plan. And then, and who are you covering? Are you covering a wife, a husband, kids, how many kids? All those things that it figures out how many questions it needs to ask and how it needs to crunch those numbers. Alex then knows what you are planning to use, doesn't know who you are, but it knows how much insurance you're expected to consume in the coming year. It knows how much the plan costs, and it uses all those things to recommend. Basically, based on what you've told me, it sounds like this is the plan for you. And then you ask it to tell you you ask Alex to show you why, and it will give a breakdown and show you, well, this is how much you're going to pay in premiums for this plan, and based on how much insurance you're looking to use, and based upon the plan design, so the co-insurance and deductible and all that information, here's how much you're going to spend out of pocket. And then it's going to tell you, would you like to see how much you could save by using a health account? And you're going to be able to go through and run some numbers to see if you can use a health account. In some cases, you'll find that maybe you're better off if you can contribute to an HSA, taking that plan, even if at first it looked like that plan would be more expensive. For other people, it's not going to show you that. It's going to be that the C2000 was the better plan for you. And that's why we really want everyone to go out and start using the tool. It's brand new this year. We did have a pilot group evaluate it, and everyone really liked it. And I think everyone laughed at least once at the corny jokes in there. So I hope you find it helpful. With the tax savings benefits that it can provide, it will provide basic savings information on taxes. If you really want to maximize that, you can provide Alex with your filing status and your income, and then it'll take the amounts you're looking to contribute, and it will give almost down to the penny what you could end up saving on taxes, because that's really all it needs. Again, Alex does not know who you are when you log in. You're not giving it your name, your birthday, your social security number. This would be the most information that you're giving that could potentially be, personal information. The one other thing that Alex will ask you for is your email address, and that's if you want Alex to send you a link to get back in and not have to re-enter all the information. So for me, I'm going to go through, I'm going to fill it out. I'm going to give Alex my email address because I'm going to sit down with my wife and say, what did I do wrong here that you would not want me to do? And if you have no changes, this is the plan it's saying we should take. What do you think? So that's a good way to do it. I know I would probably not remember exactly what I put in every single time. That is optional. The filing status and income also optional. We have some other decision support tools available. A couple of them are probably in your folder. I know that the Guides to Understanding FSAs, HRAs, and HSAs is. There's some other comparisons between CDHP and HDHP, which are the two plan types that you have to choose from. And then some FAQs. You get to the Reference Center, and this is where you can help yourself go to sleep at night by reading a benefit booklet that's dozens, if not a couple hundred pages long. There is benefit to that, though, for some people. The benefit booklet would be where you'd go to see if maybe a certain medical device is covered on the plan, something that if you called the health team, that's where they're going to look, because as much as they know, they haven't memorized every single medical device, and I wouldn't expect them to. More information on reimbursement accounts, and then our privacy notices if you'd like to see how we handle the data that's entered into the system. Annual election is going to be November 1st through November 16th. So you have plenty of time to use Alex and to figure out what plan you may want. Alex will not go away. Alex will be available there as well. If you do not make an election, the given or default plan will be the H2000 high deductible health plan. Note that I did not say at that point with an HSA, because if you do not go online and accept the terms and conditions of the HSA, BNY Mellon cannot legally open an HSA in your name. We actually have that built into the annual election process that you can read and click. I think you click yes and I agree, or I agree and yes, or something. It's 2 clicks. Read through it. Because if we didn't have that built into the process, they would not establish your HSA until they mailed you their terms and conditions and you read them and mailed them back. So you definitely want to do it this way. The other thing you won't have is dental coverage. The default or given plan for dental is no dental. And then the given plan for vision is the exam-only plan, and that's the zero-cost plan. So again, if you do not go online and elect your benefits, you will have the H2000. You will not have the HSA, which means you will not have the $500 or $1,000 that is part of the plan. You will be forfeiting that. You will not have dental, and you will only have an exam benefit for vision. Make sense? Okay. I'm not going to walk through all these screens. These are just showing you what annual election is going to look like, and I just have a couple comments that I'm going to make on these. The first is that all of your premiums are going to show as $0. That does not mean that medical, dental, and vision are free. The costs of those plans are on the sheet that Betsy handed out. The issue we have is that the billing is done so differently across all the conferences. We have over half of the annual conferences of the UMC in HealthFlex now, with you and Minnesota joining next year. And the rules are just something we haven't been able to get down to get that in the system. Too many costs. So for now, those are going to be $0. The amounts you will see are any HSA or FSA contributions that you've chosen to make. And that's what you'll see here. So when you get to the end, when you agree to and confirm your benefits, it's 2 steps. So please note when you go through, make sure you get all the way to the end and get a confirmation number. That's how you know your elections were saved. Any dollar amounts you see here, though, will be for health accounts. Quick review of the timeline. I think most, if not all of you, have received the first mailing that came from the East Ohio Conference. One of the things that was on there was that this workshop was happening today. Alex Benefits Counselor is available now. I really hope that everyone goes out and uses it. It is really helpful. It can help you make the decision, explain some things that maybe I didn't do too good a job of explaining. In mid-October, I think it's either the end of this week or early next week, that our annual election mailings are going to go out. That's going to include instructions on how to set up WebMD, because that's where you're going to log in to make your elections, talk about the time frame for AE. It's also going to promote Alex. Again, we're really, really excited about Alex, so you'll hear a lot about Alex. November 1st through the 16th is when you will make an election. You can go in and make elections as many times as you want. The last one for which you get a confirmation number is the one you'll have. And again, if you do not make an election, you will get the H2000 plan, no HSA, exam-only vision, no dental. In December is when ID cards are mailed. And then January 1st, your benefits go live. Now Todd's going to come up and he's going to talk about the well-being programs that I kind of went over very, very briefly.
To start with, everything that I'm going to talk about today will be sent to you in a mailer in the middle to end of January. And it will show an entire roadmap of what 2018 looks like as far as what's available to you with our well-being programs. And then secondly, I also wanted to mention that participation in the wellness program is completely voluntary. So there are some incentives that if you participate and meet certain, you do certain things, you'll actually receive a cash incentive for. And then you can also use the health team. You can actually contact the health team if you have any wellness related questions. They've been trained on how to handle those questions. If they're unfamiliar or can't solve that, they will find the resource, potentially ask me, but we'll be able to get you that answer back quickly. So as Bob talked about, the first step would be to register in at the HealthFlex WebMD website by going to WestPath, click on HealthFlex, and then you would log in. Actually, you'd register there. My recommendation then is once you're registered in HealthFlex WebMD is to bookmark that on your browser so that should you need to go back into HealthFlex WebMD, and you will, that it's convenient for you. So you just click on it and you'll be sent right there. The Center for Health uses a 5-component model with regards to well-being, and a little history lesson around wellness in the workplace. It's been around for probably 30 or 40 years. The focus initially was primarily on physical health. The idea was if they provided flu shots, biometric screenings, and things of that nature, it would help to reduce medical care spend. And it was somewhat successful, but over the years, it's become obvious that the human being is a lot more complex than just the physical dimension. So corporate wellness has blended into what is now referred to as well-being, because it takes a holistic approach. It looks at the entire individual, which for our model includes physical, emotional, spiritual, social, and financial. And we have programs that fit into each of these categories. With the physical dimension, you're probably familiar with Virgin Pulse as Virgin Health Miles. Several years ago, they changed their name to Virgin Pulse because they too have grown away from just being a physical activity company. So it's still pedometer-based or activity tracker-based. You'll actually go into your HealthFlex WebMD account from your bookmark on your browser, register with Virgin Pulse, and then it will direct you to purchase a max pedometer. And you have the ability to select one that goes on your hip or that one goes on your wrist. That credit, that free pedometer, that free max will always be there for you. If you currently have, let's say, a compatible device like a Fitbit or a Garmin, you can connect that device right there when you register your account. If that device breaks or you lose it, remember that you can always go back into Virgin Pulse, into the store, and select that max pedometer. We always want to make sure that you have that available, and it won't go away until you use it. They also have a very detailed, very easy to use mobile app. So then your next step would be to download that mobile app. You can do everything on that mobile app than you can on the desktop. So the program has really evolved. There is, you get points for uploading steps, tracking your healthy habits, doing some other activities, so it's just not physical activity based. As you earn points, you'll progress through levels, and as you hit level 1, level 2, level 3, you'll earn a cash incentive. Virgin Pulse calls that Pulse Cash. It's really just cash. It's for you to spend. There are a couple other programs where you'll actually earn cash. So you earn that Pulse Cash. That also gets deposited back into your Virgin Pulse account. So it's almost like Virgin Pulse is an activity well-being program, but it also serves as our bank to some degree. You can spend that money by transferring it to your bank account. You can go into the store and purchase a new device, a gym bag. It's a pretty fairly robust store around fitness and wellness. You can also direct that money to a charity that they have listed. They've vetted 2 or 3 of those. We are currently working with having them add a UMC charity like UMCOR. That is something that will be, to be honest, down the road. That seems to be a lot more complicated than it should be, but the reality is that it is fairly complicated. And then the other way to do that would be to get a gift card. And the gift card opportunities are all the big box stores from Home Depot, Amazon, Nike, Kohl's. So there's quite a number of options to get your money out. Blueprint for Wellness is hosted by Quest Diagnostics. Bob and I have been driving around the countryside the last couple of days, and we're enlightened to see that there's a number of Quest Diagnostic locations that seem to be pretty easy to find. You have a couple ways to participate in the screening with Quest, complete the biometric screening. One would be to complete it at annual conference. The second would be to complete it at a patient service center, which that's the locations that Bob and I saw while we were driving around. The other opportunity would be to bring the physician form to your doctor, have your doctor fill it out, and then fax it back to Quest. Approximately 3 days after completing your screening, your blood results will be available to be viewed online on the Quest site through HealthFlex WebMD, and you can print out your results from there. That information will also be sent over to WebMD, and it'll populate 2 spots of WebMD. One is your personal health record, and the other one is the HQ. About 3 weeks after your screening, you'll get a comprehensive report in the mail that you can bring back to your physician. There's 28 different tests in the biometric screening. It includes cholesterol, glucose, so cardiac, liver, pancreas, and a number of other tests, so basically 28 different tests. And then also blood pressure, cholesterol, and height, weight, and waist circumference. So very comprehensive tests. The HQ is an online health questionnaire. It takes about 10 to 15 minutes to complete. It's a lot shorter to complete. They've gotten a lot easier to complete over the years because they know how to ask the questions to get the information out. In addition to that, all of your biometrics are going to be pre-populated in the HQ. So you don't have to worry about entering your weight and, oh, what was my cholesterol? And, oh, what was my blood sugar? All of that's going to be pre-populated by completing that Blueprint for Wellness screening. Once you complete HQ, you will have an opportunity to set up an appointment with a health coach. You can designate when you'd like to be called. It could be several months in the future, or it could be you make an appointment for the following day. The health coaching is provided by WebMD. They are located in Indianapolis, Indiana, and they have backgrounds that include all the professions from nursing to exercise physiology, registered dietitians, and they also have some individuals who are considered stress specialists. They're clinical counselors, clinical social worker. So they are able to work with you on whatever you'd like to work on. It's considered whole person coaching, so it could be increasing physical activity, it could be improving your nutrition, and actually we have a pretty good decline in the level of stress in those who are actually participating in coaching. So they're not directly working on stress, yet by working on the other components, we're actually seeing a nice stress reduction. eVive is our partner who actually sends out the preventative screening reminders. So you'll get a batch of stickers beginning in January that you could place on your calendar as friendly little reminders. And then you'll also get reminders for the other activities that are going to be held next year. HQ completion, completing the BFW screening, as well as any kind of other preventative screenings like flu shots, or any other kind of preventative screenings that you may need. If you have a chronic condition like diabetes, they'll also send you some reminders to stay on top of that care as well. So the clinical status is to have 2 HbA1cs measured per year. You may get a reminder that says, hey, don't forget, you need to get your second blood test done, or make sure that you get your eyes examined. And that's, again, designed to help you stay on top of your care. NutriSavings will be launched for the entire HealthFlex population January 1. We've been piloting that for about the last year. And it's actually been a really fun, successful program. It's designed to provide you with education at the point of sale. So you bring your mobile app on your smartphone into the grocery store, and you're able to scan items, and it will recommend healthier items. So you could scan one version of a Triscuit, and it'll give you a healthier example of a Triscuit. So it can help you shift your decisions based on that education right there at point of sale, or actually point of selection. With the emotional dimension, we have the employee wellness or employee assistance program. Bob had mentioned that there's 8 in-person or telephonic sessions per person, per condition or situation per year. That phone number is on the back of your HealthFlex insurance card, so you always have that handy. When you call in for that type of service, they will give you a couple providers in the area that are in network, so they're part of UBH. So should you need more than 8 sessions, You will transition from the EAP benefit into the behavioral health benefit, and you won't have to worry about a break in care. The work-life program is probably my favorite part of it because the benefit is so broad. It says there's no small, it takes care of any small question or big question. So the idea is to be able to bring you to a decision point quicker. If you go into Google and you type in elder care, you're inquiring about elder care for your aging parent, they live in Seattle, you type in their zip code, you'll get 1 billion hits. So you're not any closer to making a decision by searching that way. By calling that same 800 number that you'd use for the emotional support line, you'd actually talk to a research specialist, and they would go in and find providers that they've worked with and that they've already vetted so that they're a quality organization. They would bring that down to a couple, say 2 or 3 options, and then you would be able to contact those 2 or 3 providers to determine who you'd like your aging parent to go to. So the idea with the work life is to bring you to a decision point a lot quicker. The Live and Work Well website is available online through HealthFlex WebMD, and there are tons of resources there around every aspect of health and wellness. The spiritual dimension is something that we're trying to continually develop at the Center for Health, and currently we have resources on spiritual retreats and renewal, information on meditation, mindfulness, and resiliency. And then in addition to that, Virgin Pulse offers this unique ability for every participant to be able to challenge one another to a friendly competition. And they're called healthy habit challenges or activity challenges. So in this case, you'd customize the healthy habit challenge to a spiritual theme. So the Dakota Annual Conference actually held 2 of these during their annual conference this past year, and it went over very well. What they did was they used the Healthy Habit Challenge. They customized it so that it would be, did you read the Bible today? That was one. And the other one was, did you say kind thoughts to somebody? And it just allowed them to step back, take a moment, and think, all right, what are we really here for? And I think we had 400 or 500 people participate in it during those 4 or 5 days of their annual conference. The social dimension, Virgin Pulse offers the ability for anyone in the program to run a challenge. You can actually invite up to 249 of your favorite people to a physical activity challenge. The healthy habit challenges, you can also invite people to participate in that. Virgin Pulse also offers 2 large corporate challenges. One is all the UMC as one team against their other large clients. That's typically in the fall. The other challenge is typically done in the spring, and that's a conference-to-conference or plant-sponsor-to-plant sponsor-based contest. So it's a great way to build camaraderie, increase your physical activity, and get those folks who aren't enrolled involved. There's also a social feature within the platform, and it's under social connections. You actually can go into that and then search for everyone who is enrolled in the UMC program. There's approximately 20,000 plus enrolled participants. Those are involved in HealthFlex and those that aren't involved in HealthFlex. You have the ability to search for all those folks and connect with them. For about the last 18 months, the Center for Health has put together a newsletter that comes out every quarter. There's a common theme for that. It could be financial, it could be another well-being topic. And then within that, there are experts that talk about that particular area of expertise. And there's always 2 wellness bulletins that can be printed out and shared with your congregation or your other work groups. And then Weight Watchers is available. It's a very good deal. HealthFlex pays 50% of our corporate rate. And because we're such a large client, we get a very good rate on that. You could participate at an in-person meeting at the workplace if there's enough participation. You can also participate at a local meeting or actually participate online. The financial dimension. EY, also known or formerly known as Ernst & Young, offers a comprehensive financial planning services package to all of our HealthFlex participants. It's free of charge. They won't sell you anything. They're also experienced with and knowledgeable of our retirement programs, as well as the clergy, some of the clergy tax concerns, specifically around the clergy housing allowance. So they are experienced with handling all of that. As far as the incentives, Virgin Pulse, you can earn up to $160 annually. That breaks out to $40 per quarter. $100 for completing the Blueprint for Wellness screening. The wellness points, those are primarily earned through the HealthFlex WebMD website. You can participate in the health coaching. You'll earn 25 points for each coaching call completed. So you can actually complete your wellness points by about the end of the first week of January. We do have a couple of folks that do that. I just figure they're getting they're getting a jump start on managing their health. And then with the HQ completion, you'll actually, both the participant and spouse will need to complete that in order to avoid the higher deductible. You'll actually complete that next summer, fall to avoid the higher deductible for 2019. So there's no need to complete that now. So to get started, the first step would be to register on HealthFlex WebMD. Once you register, you can actually start reading success stories. That's one way to earn wellness points. You can also participate in the Digital Health Assistant. That's another way to earn the wellness points. And then, of course, the health coaching as well. The health coaching won't be available until January when that program goes live for you. But the other part you can engage in now. Virgin Pulse will be available to you January 3rd. Please go in, register, select your device if you need it. It's not bad to, if you have a device right now, you can go ahead and order that at the time you enroll, because then you could just put that on the bench as your backup quarterback, and should you need to call in the backup quarterback, you'd have that right there available. NutriSavings and Weight Watchers will be available January 1, and then watch out for those eVive Health reminders coming in January. The Center for Health newsletter is posted in a couple different spots. One, it's on westpath.org. Two, it'll be on WebMD, and then we also put that on your Virgin Pulse account.
I think now we're ready to take some questions. If anyone has anything they wrote down, anything we should revisit. Yes.
The wellness plan is just for the employee?
So the question is the wellness plan just for the employee? It's for the employee and the spouse. And the incentive dollars that can be earned by the employee and the spouse.
So you could double?
It would be up to $820 for the employee and spouse a year, yes. Yes, sir.
What's it mean, if we don't complete the HQ, we would get a higher deductible?
Right, so we have a health quotient. The question is, if we don't complete the HQ, we get a higher deductible. So that is not on the table for this year. You will not need to complete the health quotient to avoid a higher deductible for 2018. In 2018, you will receive information about taking the health quotient. What this is also called like a health risk assessment, where you answer questions, and we use the answers to those questions to figure out where we need to focus the plan going forward. It is completely anonymous. We have no idea who you are. The only information we get back, so WebMD puts this together and they say, here's the areas of concern and here's the people who answered questions. That's it. Here's the people who've completed it. If you don't complete that, then your deductible increases if you're an individual by $250 and if it's a family by $500. Annually. It starts over every year. It doesn't accumulate. It's just for that 1 year, but it does help us figure out where we need to focus the plan. Our plan is really an evolving plan over time and focused on making sure we are addressing the issues of the participants in HealthFlex who are the clergy and laity of the United Methodist Church. And that is our sole focus. So we can't just look at industry standard trends to define this plan. This is a very unique plan for a very unique group of people. So that's why we ask that you do that.
So everybody in the family, is it the family?
It's a question, is it everyone in the family? It's participant and spouse if they're both covered. If your spouse isn't covered, they don't have to take it. But it's just participant and spouse. It does not, it only takes about 10 minutes. a handful of questions, I think, in there you could even choose not to answer if you're worried, but there is no way for us to find out who answered what. It's completely anonymous. Any other questions? Yes.
On the preventive care, either plan that you go with, preventive care is covered 100%?
Yes, that is the same.
And is there a listing of what the plan considers preventive, like a flu shot every year?
Good question. So the questions were, are preventive covered in both plans, and do we have a list of what's considered preventive? Yes, all wellness and preventive are covered at 100%. Do we have a list? I'm not sure we even have a list in the benefit booklet, but off the top of my head, I know it's a wellness visit for men. It is a visit with your primary doctor for women and with your OBGYN. So that's 2 visits for women that they get per year. It is all flu shots covered, and I'm glad you brought up flu shots because we have something pretty unique with the plan. The flu shots are covered under both medical and pharmacy benefits. What we found is that when you went to the pharmacy and wanted to use your medical benefit, they didn't have a great way to charge it, so people had to pay and get reimbursed. Now, if you go to the doctor for it, generally children get them at the doctor's office, and I know my doctor doesn't have a bunch of flu shots on hand for adults, so I'll go to Walgreens or Costco or whomever. Shingle shots are covered 100%. We did hear this the other day, and the question about list of preventive services. So we're going to look to probably develop something that has an exhaustive list of what that is. Have we provided that, Betsy, that you've seen?
Not that I'm
No.
aware of.
Yeah, that's something that we need to work on. Yes.
So no mammograms?
Oh, yes, sorry, yes, mammograms are covered 100%. Colonoscopies are covered. Polyp removals are where it gets a little tricky because some doctor, if it's just a couple, they include it. If it's more than that, then they have a separate charge. But yes, there's a pretty exhaustive list. The Affordable Care Act has their list of what's covered as preventive services. We, of course, comply with that. You could probably find that online. We just don't have a HealthFlex document that lists them out. We probably need to do that. Any other questions? Yes.
Dental. I went to Cigna as, just to see what their personal one was that you could get if you were not even associated with anyone.
Okay.
So if we're going to this new plan, or maybe it has been prior that we're in Cigna, but with what we've had, okay. I thought I read something to the effect that even though you have it, you have to wait 6 months before you can go and use it.
Okay, so the question is, how long do you have to wait to use your dental benefit? If you went for a individual policy through them,
Yeah.
it's likely that they would impose a waiting period like that.
Yeah.
You're coming in as part of a group plan, so the only limitations are the 2 I covered. It's the missing tooth limitation and the orthodontia, which really just doesn't cover services while you weren't with Cigna. It's almost not even a limitation to me. It just makes sense.
Okay.
Any other questions? Yes.
And annual conference, when you do the screening, the blood test and everything, when we go to this new program as of January 1st, is there some kind of a feed that takes the data results from that and moves it into this new?
So the question was, currently you guys do a blood test of some kind, a wellness test at annual conference. That is separate from this test. In talking with Betsy, I think for sure both will be available at next annual conference, or both will be available next year. To get the $100, you would need to do the one through Blueprint for Wellness. I'm not sure, I don't know if there's a difference in the comprehensiveness, I'm not sure, but that's, again, how we use the data, again, for future planning, see how we're doing as a group, anonymous to us, not to you. You get a great booklet that really lays out a ton of information that's super helpful. I mean, I could say from personal experience, when my wife and I got ours, we looked at them and we said, well, that's not the color we want to see on this. We want to see greens and not reds. And we both went and talked to our doctors to figure out what we needed to do, and they were able to really focus on those things because it was such a comprehensive panel. And I'm happy to say that the following year our results were much better. Yes.
Aetna, I believe it is, currently has a good health history or has a record somewhere in it that if you've been in that account, you can list all of the history you've had, the medicines you've had, et cetera. I suspect we're not gonna be able to roll data from one over to the other. I guess I would ask, do we have a list of the questions ahead of time that Alex is gonna ask so we could print the Aetna report and be able to answer it intelligently? Otherwise, we're gonna be guessing back and forth. That would just be kind of a question, like of all the prescriptions we've had and doctor's visits. Because you said how many doctor's visits a year and all of that.
Right, yeah, so the question was, is there a way to get the list of questions from Alex so that you can pull the data from Aetna, services data, to be able to access that? I don't know that I have them listed out. You can certainly go into Alex to get them and then come back out. I know that's not a great answer because it's requiring you to go in once and go back in. At this point, it's the only one I can think of, but let me see if there's a way we can get a list of questions that you could post online or something that would help. Yes?
The same as with the medical plan, does the dental plan have a list of what's preventative?
So the question is, does the dental plan have a list of what's preventative? Yes, it's probably in the benefit booklet. What you're really looking at, I can tell you most of it off the top of my head. It's 2 exams per year covered, 1 set of bite wing x-rays covered, fluoride treatments for children and adults covered, and I think that's it. I feel like I'm missing one that has to do with children's teeth, but I'm not sure. Those for sure are all covered. Any other questions? Okay, well, oh yes,
Weight Watchers,
yes.
that will take effect January first, but if you're already a member before January first, you still get to take advantage of half of the premium per month.
No, actually, that would begin as of January 1.
So I would have to quit and then sign up again.
Yes.
So for anyone who didn't hear, the question was about currently in Weight Watchers, what happens on January 1 to get the reduced cost? You leave Weight Watchers, you join back up after January 1st.